A couple of days ago, I sat down and spent 90 minutes talking with Patrick McKeown. Some of you may know him as the author of The Oxygen Advantage. It's an amazing book. But he's also the world's leading authority on the Botequio method. He helps adults and children with a variety of breathing disorders, from asthma to sleep apnea to snoring, anxiety and panic. He also works with Olympians, athletes, MMA fighters, and he is just an expert on everything related to the breath. We discuss COVID-19, we discuss breath holding, we discuss well-being, anxiety, the variety of techniques you can use to calm down a panic attack. We discuss the Wim Hof method, which is a very popular breathing technique, some of the drawbacks to that. We discuss how we can improve our athletic performance with a few simple breath holding techniques. I am a huge fan of Patrick's work, and I highly recommend, if you're not familiar with him, to check him out, get your hands on The Oxygen Advantage. But this is my interview with Patrick. I hope that you enjoy it, and if you did, please subscribe, leave a like, and leave a comment. Let me know what you thought. Right, so there's a lot that I want to get into today with you. I've got so many questions, and I kind of want this discussion to be useful for people who are already familiar with your work and The Oxygen Advantage. So people who've read that, they can come to this and be like, oh yeah, I learned something new, or something was clarified for me. But also obviously an introduction for people who aren't familiar with your work too. So I think we should kick things off with just, why are you so passionate, and you clearly are, about the work that you do? Because you have so many videos on YouTube, your book, you're so enthusiastic about helping people improve their breathing mechanics and the health of their respiratory systems. And I'm just wondering what drives you, why are you so passionate about this?
My main driver is having wheezing and constant snoring and stopping of the breath as a child, the effect that it has on your concentration, your quality of life, your energy levels, and your mood. And despite going to healthcare professionals, and this is not a criticism of healthcare professionals, this is just a reality of my experience. I was going to medical doctors probably every 3 months from the age of 4 to the age of about 25, so 21 years. I was never asked about my breathing. I was never asked about my sleep. I was never instructed to breathe through the nose. I was never told to slow down my breathing. So as a kid growing up and as a teenager into my early 20s, I was a fast upper chest mouth breather. And when doctors say that has no effect on your health, I have to beg the difference, because I know firsthand it made a tremendous difference when I switched to nose breathing and when I started slowing down my breath. So I suppose my quest is really, the motive is, I will always draw on my own personal experience, and we will try and put the information out there. And, I think now breath is starting to become topical. And I've been teaching it since 2002. And yeah, definitely interest has grown and the science is starting to catch up, which is good.
So I'm surprised that you were visiting the doctor every few months. Sounds quite serious. What was the turning point? Was there like a specific, things started to shift for you and you transitioned away from typical medical advice?
Well, I had asthma. So if you have asthma, you're typically going to visit the doctor every 3 months, because that's when you get your prescriptions. And then, of course, if you have an exacerbation, you have to go whenever you have an exacerbation. And it wasn't so much that, it was just, I read an article in a newspaper, and it was about the work of this Russian doctor, Dr. Konstantin Buteco. And his research was, he was a medical doctor, and also he worked in the Soviet space race. So he worked with astronauts, and in trying to define what was the ideal composition of oxygen or air in space in terms of for astronauts traveling there. At the same time, he noticed that sick patients, they breathed harder. And he asked the question, was it their sickness that caused them to breathe harder, or was it their hard breathing which feeded back into their sickness? And he started teaching his patients to slow down their breathing. And he started noticing that they were making progress, that their symptoms were reducing, And the most popular condition originally that he worked with was asthma. So, you know, I felt firsthand as a child and as a teenager with asthma, which was getting progressively worse. When I read that article, I then started doing the nose unblocking exercise, which was online at the time. This is going back to 1997. So the internet was in its absolute infancy. But I came across the exercise, I practiced it, and it opened up my nose. And it was a simple breath hold exercise. And before that, you know, having a stuffy nose, you kind of grow to accept it. And, you know, nasal stuffiness, it affects about 30% of the population. Mm-hmm. And it can affect 30 to 40% of children. And if you have a stuffy nose, your sleep is impacted. So when we think of breathing, if breathing is off, it's not just isolated to the breath, but it is going to impact other functions in the body. So that was mine. You know, I went to bed that night. I wore tape over my lips to get my mouth closed. And I also wore breathe right strips because I had to open up my nose. And I woke up the first morning feeling, yeah, it wasn't too bad, but I didn't notice that much of a difference. But I did it again the second night. And the second morning I woke up and it was absolutely incredible. I was feeling an alertness and a concentration that I had never experienced in my lifetime. And then I knew I was onto something. And I also knew I was onto something because my asthma symptoms reduced by about 50% in that week.
Wow.
And somebody could say to me, well, that's, you know, I'm overdoing it. I'm over sensationalizing it. But, you know, look at BBC did a documentary on the Buteyko method back in 1994 for asthma. It's called Breathless. Mm-hmm. And it was QED BBC documentary. They got 3 very severe asthmatics. They put them through a 5-day program. And at the end of 5 days, look at the change to these people with asthma. And these people were at the end of the line. 2 of them were at the end of the line in terms of hospital treatments. One, Donna, she was having a hospitalization probably every couple of months. Now, to gain an improvement within 5 days, and typically we expect to get it within 2 weeks. So somebody coming in with asthma, and all we are doing is getting simple changes to their breathing. We do nose unblocking exercise, slowing breathing, breath holding to help open up the nose and the airways, and nose breathing and slow breathing driven by the diaphragm, both during rest, during sleep, and also during physical exercise. And 5.6 million people with asthma in the UK. You know, and that's just with asthma. How about looking at the individuals with snoring and obstructive sleep apnea? That's now about 30% of the work. And people with anxiety, I actually think are the biggest group that have the most to get out of this. And the reason being is because in the literature, 80% of this group, anxiety and panic disorder, they have dysfunctional breathing patterns. They have a breathing pattern disorder. It is true that when we get stressed and when we get anxious, our breathing changes. Mm-hmm. But if we are in long-term stress or long-term anxiety, the changes to our breathing become persistent. They become habitual. And even when the stress is removed, the disordered breathing remains. And that continues to feed back into the cycle. And we also have to think of, when we think about breathing, we cannot think about breathing without thinking about the emotions and without thinking about sleep. Because if our sleep is off, our emotions are going to be off. We're going to be more contrary. You know, we're not going to be as focused. We won't have the energy to deal with, you know, whatever life demands of us that day. So if our sleep quality is not good, it affects the mind. But if the mind is agitated, we can't go into a deep sleep because we are ruminating. There's so much thoughts going through our mind. So we have insomnia. So we have a poor quality sleep. And if our breathing is fast in upper chest, that's feeding into the emotions. It's agitating the mind. And fast and upper chest breathing is also contributing to sleep disorder breathing. So one is feeding into the other. And that's why I'm always saying to students coming into me, we can't just look at breathing alone. Mm-hmm. And I'm not concerned with how you breathe when you're in front of me. I'm more concerned with how is the individual breathing when they leave me, to bring these habits into their everyday life. And I think part of it is the enormous potential when we change our breathing, what and how that can influence the functions of the body that are normally outside of our control. And this is where the research is catching up, and it's tremendous.
I'm really astounded by what you say about anxiety as being one of the most important groups to learn from this, because
Yes.
I was going to ask you about this actually. I used to have anxiety and a bit of panic, and yeah, I do think that my breathing kind of became dysfunctional as a result of, I would do things like hold my breath to listen more intently. It was kind of like hypervigilant type of anxiety, and I think that some bad breathing mechanics have carried over. And yeah, it's really interesting. I never thought about it. I tended to think it's all like neurological. I have to kind of figure out past trauma and stuff, but it could just be related to my breath.
Well, if you look at the connection between, we have to consider the speed of breathing. And this was only found out in March of 2017, Stanford Medical School. They identified a new structure in the brain of mice, and then they identified the same structure in humans. And they said that there's a part of the brain that's actually spying on your breathing. And if you breathe fast, this structure will relay signals of agitation to the rest of the brain and is likely to wake you from sleep. So if you breathe slow, this structure will relay signals of calm to the rest of the brain. And I think it's because of our evolution. When we evolved as human beings, the only time that we breathed fast and shallow breathing, apart from physical exercise, was in times of stress. So the human body will always identify that fast and shallow breathing during rest is a fight or flight response. It's a stressful state. But if we were breathing through the open mouth as I was doing, mouth breathing directly activates the upper chest. I don't think you can actively breathe low if you're breathing through an open mouth. And the first thing I'll say to students coming in is look down at your chest and take a breath through the mouth. And when you take a breath through the mouth, see what part of the body moves. So mouth breathing, it doesn't create a resistance to breathing the same way the nose does. The nose has got two small entries into the face to allow air to create a resistance there to slow down breathing. And that slowing down of the breath is also helping to enable a deeper breath, in that we are taking the air down into the deeper regions of the lungs. So when we breathe slow, it calms the mind, but also there's feedback from the diaphragm to the mind as well. There's feedback from the brain to breathing, but there's feedback from breathing back to brain. And when we breathe using our diaphragm, it also calms the mind. However, there is an instruction out there that people are told when they are stressed, when they are depressed, when they are anxious, when they are having panic disorder. Take a deep breath. How is that deep breath taken? You should never hear a deep breath. A deep breath just means that you have lateral expansion and contraction of the lower ribs. A deep breath just means that you are breathing low, but you should be breathing slow and you should be breathing light. So I use kind of the words that I use. I want people, now the oxygen advantage, I had it very skewed towards the biochemistry of breathing, but I wrote that 5 years ago. And, you know, I suppose we're all in our little silos, and then we realized that there's a lot more to this. And then I started looking more at the biomechanics of breathing, and I'm still not quite there yet, but we do actively teach a lot more about the biomechanics of the breath. And we also teach coherent and cadence breathing now, which wasn't taught in the oxygen advantage. And the reason that I think about, because when we look at breathing, we have to think of it as three different dimensions. Biochemistry of breathing is all focused on carbon dioxide. How do you breathe to enable normal carbon dioxide in the blood? And by doing that, you help open up blood vessels, you help increase oxygen delivery to the brain, and that can have a calming effect. Because if you hyperventilate, or if you breathe more air than what you should be, and that's what I was doing. I had a habit of breathing hard, breathing fast, breathing upper chest. And the most common symptom that I had was no matter how much air I breathed, I still felt that I wasn't getting enough air. And it's a very common symptom of people with breathing pattern disorders. And I also had a belief when I was a teenager that it was good to take these big breaths because it would bring more oxygen to my brain. However, it was only afterwards when I started realizing that when I reduced my breathing, when I breathed less than what I normally breathed, I could influence my blood circulation. I could feel the warmth in my hands for the first time, because before that, because I was fast breathing and mouth breathing, I had cold hands, cold feet, and brain fog. So I would always say to people, look at the biochemistry of your breath. Start slowing down your breathing to allow carbon dioxide to accumulate in the blood, because if you reduce the amount of air that you breathe, you are not going to be breathing out so much carbon dioxide from the blood through the lungs. And it's not that we want to deliberately have over carbon dioxide, no, but we want to have normal carbon dioxide. And because the functions of carbon dioxide, it's not just a waste gas. It plays a role in opening your blood vessels. It improves your blood circulation. We have 70,000 miles of blood vessels in the human body. You can influence that through your breath. But it also plays a role in the release of oxygen from the red blood cells, from hemoglobin. So hemoglobin, which is a protein within the red blood cells, it releases oxygen to tissues and organs in the presence of heat and carbon dioxide. And this is why I think we have to look at, why is there an instruction out there about taking these big breaths? Because all it's doing is depriving the brain of oxygen. This increases neuronal excitability. The central nervous system is agitated as a result of hyperventilation, and all it's doing is feeding into stress. And I think not just to look at the biochemistry of breath, but also to look at the biomechanics, to breathe low using the diaphragm. And then to look at cadence breathing, which is slowing down the respiratory rate to 5.5 and 6 breaths per minute, to stimulate the vagus nerve, to increase vagal nerve traffic, and to increase heart rate variability, respiratory sinus arrhythmia. It's amazing the research that's coming out in this. So breathing for functional breathing, both during rest, and how you breathe during rest determines how you breathe during sleep. And also what we are doing is, I want to give people the resilience. You know, I see people coming into me with panic disorder. I look at their breathing. Invariably, it's typically fast and shallow. These people are teetering on the brink of symptoms. It's not the crowded place that puts them into symptoms. It's not the crowded place that's the problem. It's not driving their car that's the problem. It's not the stresses of everyday life that's the problem. It's that their resilience has been impacted. They don't have the resilience to cope with these, you know, these demands that life is putting on us. And as human beings, we have to be adaptable. But the best thing is that we can improve our resilience by focusing on the breath. And it's not about taking the big breaths. And I think there's a huge misunderstanding out there about breathing. And also, how many people with anxiety are going to healthcare professionals? They're doing cognitive behavioral therapy, which is great, but nobody is looking at their sleep and nobody is looking at their breathing. And I mean, looking at their breathing in terms of optimizing their breathing for calmness of the mind, for blood flow, and for oxygen delivery to the brain. It just makes sense. And as human beings, we are all in our silos, you know? So it's time, I suppose, to generate a bit of debate about this and awareness. And, you know, people might say to me, well, you know, Patrick, you're saying to me to breathe less. I'm only saying to breathe less if you have a habit of over breathing. If your Bolt score is low, because what I want to try and do is improve your Bolt score to the point of functional breathing. And then other people might say, well, what you're saying is different to what everybody else is saying. And people will say, well, they can't all have got it wrong. And I said, I think they do. I think they have. I think there is something crept in to the Western mind about the importance of taking big breaths. And I would say then to that student, I want you to practice this for 2 weeks and see, does it make a difference? Play with the breath yourself, you know, because there are many different techniques about breathing, and it must be very confusing to the lay person. They're hearing hyperventilate from one person. They're hearing don't hyperventilate from another person. They're hearing, you know, hold your breath here. Don't hold your breath here. What do you do? Well, the best thing is, I suppose, do breathing exercises and put them into practice. Do them gently first. If you are prone to panic disorder, you do typically or can have a strong feeling towards suffocation. And that is the one group that I have to be more gentle with. And the reason being is because there seems to be two subsets of people with panic disorder. One subset can cope with air hunger. And we have them do slow breathing and they feel air hunger and they can cope fairly okay with it. Yeah, it's a little bit uncomfortable, but it's uncomfortable for everybody. There's another group of people with panic disorder, especially those who have such an adverse reaction to the feeling of suffocation. And when I put them into air hunger, instead of putting them into a relaxation response, puts them into a fight or flight response. So I have to go very gently with that person because I don't want to put them into too much of a sympathetic tone. But at the same time, I want to give them a dose of air hunger because it's the feeling of suffocation that puts them into that panic disorder. So what I want to do is to give them a teaspoon of air hunger to decondition them towards the feeling of suffocation so that they can cope with it better, so that if they are feeling suffocation, or if they do feel that they're breathing, that they're feeling air hunger, that it's not going to feed back into it to set off an attack.
Wow, this is super interesting. I could go off in so many directions, but I just want to get a snapshot of the type of people that you work with at the moment. So you've mentioned people with asthma, people with anxiety.
Yeah.
You also work with athletes as well. Could you give a snapshot of the type of people you work with?
Yeah. From 2002 until 2013, 2014, I worked mainly with unhealthy people. And the breakdown there would be 30% were people with asthma, 30% were people with sleep problems, sleep apnea, obstructive sleep apnea, snoring, insomnia, and 30% with anxiety and panic disorder, and children and adults. And then in 2013, 2015, I wrote a book called The Oxygen Advantage. And that opened it up to the healthy audience. And that opened it up for performance, for both performance of the mind and also performance during sports. So now 50% of my people are people who are unhealthy, and 50% are people who are healthy. I often wondered, in 2010 I started, because we had a dreadful economic recession as a result of the financial crisis. And I put out courses out there about, I call them mindfulness and functional breathing. Because I often felt that, people who are doing mindfulness and meditation, and it's an excellent modality, but I think we have to go a bit deeper into it. We need to look at how is that person breathing, and we also need to look at their sleep. And typically individuals who are teaching mindfulness, they will say, never change your breathing. And that's all very well. And the reason that they say never change your breathing is because they have a belief that your breathing will sort itself out if you keep on doing meditation. Now, the only issue that I would have with that is that mindfulness was developed 2,500 years ago. And we have developed and we have moved on and we have become a very stress-driven society since that. So you could be doing meditation, but then you were exposed to a lot of stress in your everyday life. And you're not going to get the pure gains of it. And the other thing is that the very group of people who can get the most out of meditation, they are not able to do it. And the reason being is because they have an emotional turmoil in the mind. They have developed a habit of thinking and they cannot step out of thought. So, and the other thing is it can be very frustrating that if you are performing a task to bring your attention out of the mind onto the breath, but if you are not able to hold your attention on your breathing, you will then feel that you're not able to do it, that you're a failure, and you're going to give it up. So back when I was giving courses to about 3,000 people, and the majority of people turned up for these mindfulness and functional breathing, where 90% were females. Males weren't turning up. And that's why part of my motivation for the Oxygen Advantage was to develop a technique that I can bring in the mind for males and bring it right into sports performance, but not even just focus on the mind in terms of sports performance, also focus on breathing techniques to improve sports performance. So the Oxygen Advantage was born out as a result of that. And it's been really, really interesting bringing breathing to healthy people and pushing them through it. And we have some amazing athletes doing it. We have really, really high caliber Olympic. Well, they were preparing for Rio. I'm not sure where that stage is now at the moment. We have professional MMA fighters, professional soccer players, and we have a myriad of different disciplines putting it into practice. And yeah, I think it's been fun. It's been fun opening up, because breathing was one of those things that had bad press. It was typically seen as the domain of tree huggers, or what's wrong with your breathing? Sure, take a few deep breaths out of it. But it's when you break down the breath. And when we're working with athletes, we're looking at improving their functional breathing during rest, during physical exercise, during sleep, but we're also looking at doing breath hold training to lower their blood oxygen saturation, to increase their carbon dioxide, to disturb the blood acid base balance, and to force the body to make adaptations to delay lactic acid and fatigue. And the science is coming out. So I think it's all good. I think it's an interesting concept. So yeah, 50% of the people I work with are unhealthy. They are doing it to improve their health. and 50% are doing it to improve performance.
The way that I found your work was, so I train at a MMA gym, and I was speaking to someone, and they were saying that if you get too stressed when you're doing jiu-jitsu, you won't be able to think of the move you need to do. So you've got to get your breathing sorted. And I always found in between rounds, I'd be like gasping for air, looking around and seeing everyone else was fine. And I was like, what is going on? And I had this faulty assumption, as you pointed out, that carbon dioxide is bad, oxygen is good, got to get as much oxygen as possible. And then I read your book, and you were saying like, you actually want to breathe slowly and calmly through your nose in between, when you're resting between exercise. So I tried that, and it was like the resistance to kind of doing that was like difficult at first, but then within like 20 seconds, I was calm. It was like kind of a magical kind of effect.
Yeah, that's great. It's great that you felt it so quickly. And, I understand there can be with some people, they mightn't feel it quite so quick.
Yeah.
That when you first switch from mouth to nose breathing, especially when you do physical exercise, you feel an increased sensation of air hunger. Mm-hmm. But the air hunger is just because carbon dioxide is increasing in the blood. I would say keep doing the physical exercise with your mouth closed, because then what happens is by exposing your body to the increased carbon dioxide, your body adapts to it. And then your feeling of air hunger decreases, but your ventilation during physical exercise also decreases. So, breathing, then you're talking about gassing out. You can imagine anybody who's doing Brazilian Jiu-Jitsu, they really need to have a long breath hold time, because even if they were in a chokehold, can you imagine somebody, they're a little bit gassed out, and then the next thing is they're in a chokehold, well, they would probably tap out very, very quickly. But if you were able to surrender, and if you were able to hold your breath for a long period of time, even because your blood oxygen saturation will probably be dropping. And of course, you don't want it to drop too low to the point of you pass out, but it takes a long degree. It takes really severe hypoxia to cause somebody to faint. Your blood oxygen saturation has to drop down to about 60%. A long breath hold time is certainly very beneficial for somebody who is in sports, because it's a marker of the degree of breathlessness. And, somebody who is gassing out too soon, a strength and conditioning coach may say that that person has got poor condition. They've deconditioned. But that's not necessarily the case, because you can be training hard and doing everything right, but your breathing is off. Physical training does not improve your breathing. Doesn't improve it, because how you breathe during physical training is determined by how you breathe during rest. So what we need to do is improve the breathing during rest, and that in turn, by improving both score, that will transition to improve breathing during physical training.
It makes so much sense. Could you explain, because I think this is a very important point, could you explain what the BOLT score is and how we can measure it?
Sure. So the BOLT score is a simple test. You just need to watch your second hand phone with a second hand. You're sitting down for about 5 minutes. You take a normal breath in and out through your nose, and then you hold your nose and you time it in seconds until you feel the first definite desire to breathe. And then you let go of your nose and you breathe normally. It's an indicator of the length of comfortable breath hold time. It's a length of time that you can hold your breath following a normal exhalation until you feel the first definite desire to breathe, or the first reaction from the brain telling you to resume breathing. So in theory, it's taught that your BOLT score gives you a feedback of the chemosensitivity of the body to carbon dioxide. However, there are other influencers on BOLT score: genetics, anxiety, asthma. So there are a few things that can lead to a lower BOLT score. And I would say that quite a few people with asthma, anxiety, panic disorder, they would have a tendency towards a lower BOLT score. So they will have more work to do in terms of improving their breathing, because that's the one group that will probably have a tendency to gas out too soon, even if they don't have asthma now, but if they had childhood asthma. So yeah, the BOLT score, it's not perfect, but it's a fairly good indicator. And there was a paper published by a professor of physical therapy in 2017, Kiesel, and he looked at 51 subjects. And he concluded that the breath hold time, if it was above 25 seconds, there's an 89% chance that dysfunctional breathing is not present. And what's more, the reason that he was interested in breathing, because as a physical therapist, was because of the relationship between functional breathing and functional movement.
Mm-hmm.
If your breathing is off, your movement is off. So if you have dysfunctional breathing, you have dysfunctional movement. And if you have dysfunctional movement, you're at a greater risk of injury. So the diaphragm breathing muscle is not just about respiration, but it's also for stabilization for the spine. It's for the generation of intra-abdominal pressure. And it's, in intra-abdominal pressure is like you can imagine a weightlifter breathing in.
Mm-hmm.
They typically will breathe in, they hold their breath. And as they breathe in, their diaphragm is moving downwards. And this is creating the abdomen, a stabilization effect in the abdomen, almost that the abdomen becomes like a pneumatic balloon to prevent the spine from buckling. So functional movement, functional breathing, and it's just the interconnectedness in the human body. If one function is off, it can affect the others.
And if someone has a BOLT score of 40, like let's just say, what kind of, and obviously if you're an athlete or you're involved in sports, the benefits are kind of obvious. But what if you're just an ordinary person who doesn't do sport? What kind of benefit can you get from increasing your BOLT score from, say, 15 to 40? What kind of differences can you expect?
Well, not everybody will increase to 40 seconds. So most people will come in at 15 seconds. If we can bring them up to 25 and 30 seconds, it's a huge improvement.
Mm-hmm.
And it's manageable and it's achievable. The individuals that tend to reach the 40 seconds tend to be elite athletes.
Mm-hmm.
And we also had some SWAT personnel, their special weapons and tactics, from the United States. And they were achieving a BOLT score of 40 seconds. But I suppose they will be in the realm of athletes in terms of the amount of physical training they do, etc. The benefits that it will bring to you is, these are not in any particular order, but most certainly sleep is much better.
Mm-hmm.
Sleep disorder breathing to reduce, because as you have a higher BOLT score, your breathing becomes lighter, slower, and deeper. And as a result, then there's less turbulence in the upper airways. Your sleep quality is deeper when you breathe through your nose and when you breathe light. You need less sleep. You wake up more alert. Your focus and concentration would be better, and your ability to handle stress would be better. And the reason being is because resilience of the individual improves with a higher BOLT score. Now, there's a connection between the sensitivity of baroreceptors, which are pressure receptors inside the major blood vessels. And these pressure receptors play a huge role, a significant role in the functioning of the autonomic nervous system. So you have pressure receptors inside the major blood vessels in the aorta and the carotid arteries. These pressure receptors are monitoring blood pressure. And if blood pressure increases, these pressure receptors react by causing blood vessels to dilate and dropping the heart rate in order to bring blood pressure down towards normal. Mm-hmm. Or if blood pressure drops, these pressure receptors cause blood vessels to constrict and the heart rate to increase to bring blood pressure back up towards normal. And the pressure receptors, modification of the pressure receptors, the baroreceptors, that in turn modifies the chemoreflex. So the chemoreflex is related to BOLT score. So we know that when you do a cadence of 6 breaths per minute, if you look at the work of Luciano Bernardi, an Italian doctor, who has about 500 papers published on PubMed, and many of these are on slow breathing and optimizing ventilation. So when you slow your breathing down to a cadence of 6 breaths per minute, it stimulates the baroreceptors, which in turn modifies the chemoreflex, and your chemosensitivity to carbon dioxide is indicated by your BOLT score. As you have a higher BOLT score, one could also ask the question, does a higher BOLT score also mean that you have high sensitivity of the baroreceptors as a marker of resilience? So I think there's what are the other main benefits? Well, if you look at the symptoms of dysfunctional breathing, and dysfunctional breathing can affect any organ or system to different degrees. It's not just related to the breath. It can affect, the brain. It can affect the gastrointestinal tract. It can affect the heart. It can affect the musculoskeletal system. So it can affect any organ or system to different degrees. And typical symptoms that result from hyperventilation or disordered breathing are premature breathlessness during physical exercise, exercise intolerance, respiratory muscle fatigue, exhaustion, anxiety, and there's, irritable bowel syndrome can fall in there. And also through the breath, by tying this in. So if you have dysfunctional breathing patterns, you tend to breathe fast up our chest. And it's almost that you're in that state of fight or flight.
Mm-hmm.
And that's what we want to do, the opposite. We want to bring breathing down into light, slow, and deep. And people to remember it will remember it by LSD, light, slow, and deep. When you have conditions and symptoms, and the most common conditions such as asthma, COPD, irritable bowel syndrome, fibromyalgia, anxiety, depression, PTSD, hypertension, hypotension. These individuals have poor and low heart rate variability. And what that means is that their timing between beats, the or intervals, are not random. Mm-hmm. You don't want your heartbeat to be the same. You don't want the time between each heartbeat to be the same. A good indicator of the functioning of the autonomic nervous system as an index of parasympathetic tone is that as you breathe in, your heart rate should be getting faster during rest. As you breathe in, the heart rate should be getting faster. And as you breathe out, the heart rate should be slowing down. So the inspiration is sympathetically driven. Mm-hmm. During the breath in, the vagus nerve draws back. And on the breath out, the vagus nerve is primarily responsible for activation of the parasympathetic response on the exhalation. So the breath in could be regarded as a sympathetically driven, and the breath out as parasympathetically driven. Now, if we slow down the breath to 6 breaths per minute, that in turn increases vagus nerve traffic. That in turn, so there's two things that happen. You slow down your breathing to 6 breaths per minute, it increases vagus nerve traffic. It also exercises the baroreceptors, which we spoke about, to make them more sensitive. This in turn, both effects then will contribute to improving heart rate variability. Mm-hmm. And the relationship between heart rate variability and your breathing is respiratory sinus arrhythmia. So without going too complex to it, but if you had people simply locate their pulse, then feel their breathing and ask themselves the question, well, as you breathe in, is your heart rate getting faster or slower? And as you breathe out, is your heart rate getting faster or slower? And that in itself is an indicator of functioning of your autonomic nervous system. But what's more, individuals with low heart rate variability, you can increase that quite significantly by slowing down the respiration to 6 breaths per minute. But people with a low Bolt score, they are caught for breath, they are breathing 18 breaths per minute, they are breathing 20 breaths per minute, and I think it's a major stress to the body.
Mm. I've been tracking my Bolt score since reading your book, and one thing that I was unsure about is at what point is the definite desire to breathe? Because sometimes I kind of feel like, oh, I'd like to breathe after maybe like 5 seconons, and then there's like small contractions of the diaphragm. Yeah. Is that it, or is it when it's like more the
first involuntary? Well, it's the first definite involuntary contraction. If you just feel a flutter there, I would ignore it.
Okay.
If you just feel the first little sensations of air hunger, I would ignore it. So it's the first. Or you could look at it this way: you're holding your breath on an exhalation, mm-hmm. until you're holding your breath for as long as you can, but you have to resume normal breathing at the end. Now, maybe that might confuse people because they might force the breath into place at the end. So maybe I'll describe it a little bit different. You take a normal breath in, a normal breath out through your nose. You're pinching your nose with your fingers, and you're timing it in seconds until you feel the first involuntary movement of the breathing muscles. Mm-hmm. But your breath at the end should be fairly normal. Now, you can think of it this way, that as you hold your breath or as you stop breathing, carbon dioxide increases in the blood pH drops, and the medulla reacts to the drop to blood pH by sending a stimulus to breathe. So that's why you have an involuntary contraction where your diaphragm pulls downwards, mm-hmm. in an effort to take air into the body. So you would think of it as the first definite reaction of the brain to breathe And human beings, if we stop breathing, well, at some point, the brain is going to respond by telling the body to breathe. That's the Bose score. So it's not a measurement of the maximum length of time of breath hold. Now, we do have one of those tests, which is called the maximum breathlessness test. And that's a very interesting one for MMA fighters or any sports, anybody involved with sports. That's when you take a normal breath in through your nose, a normal breath out, you hold your nose, and you walk and you count the number of paces that you can hold your breath for until a maximum. 1 second there. So we have a manual like that we give out to our these are for the instructors. And I'll just get the table from it. Like put the table up there and I can put, so the maximum breathlessness test is also a good, we use two measurements in terms of when we were looking at breathing. The Bose score is to give you feedback of functional breathing patterns and also the degree, the onset and endurance of breathlessness. So that's what the Bose score is. Now, another test is the maximum breathlessness test. And that's the maximum tolerance or the upper limit of tolerance of breathlessness. So to measure the maximum breathlessness test, now, by the way, don't do this if the female is pregnant or if the individual has any kind of serious health or medical conditions. Don't do it because it's quite tough. You take a normal breath in and out through your nose, you hold your nose, and you start walking holding your breath. And you count the number of paces that you can hold your breath for up to a maximum. At the end, you let go, but you breathe in through your nose. So you have to bear in mind that the maximum breathlessness test is the number of paces that you can hold your breath for a maximum after a normal exhalation. So it's a normal breath in and out and hold and walk, count how many paces to a maximum. So that's measuring your upper limit of tolerance of breathlessness. Now, there is a relationship between the Bose score and the maximum breathlessness test. So when the Bose score is 10 seconds, the maximum breathlessness test is typically between 20 and 40. When the Bose score is 20, the MBT is between 40 and 60. And the cutoff point is that we need individuals to have a Bose score of 25 seconds and a maximum breathlessness test of a Bose score of 25 seconds and a maximum breathlessness test of 60 paces, and above that. And, there's also some, like I spoke about this at the very start, I think it's very important that when we are considering breathing, that we look at the three-dimensional, the bidirectional relationship between the emotions, breathing, and sleep. And surely these are the most important functions of the human body in terms of quality of life. Having good quality sleep, both for children, teenagers, and adults, how that impacts the emotions. With emotions, we want to have a clarity of mind, and we also want to have an ability to concentrate. Concentration is your ability to hold your attention on a subject matter for a period of time without distraction. However, like me in my teenage years, I would be going to school, I would be reading information from a textbook, I would be looking at the textbook, but my concentration wasn't there. My concentration was stuck in my head. And I had never developed the capacity to get out of my head, to take my attention out of my mind and to place it on what I needed to place it upon. And the issue there is that if you don't have the ability to hold your attention on a subject matter, whether it's academia, whether it's quality, whether it's your work, or whether it's even just relationships, if you don't have your capacity to give your full attention during that time, your quality of work is going to suffer. And people talk about multitasking. It's nonsense. You cannot multitask. If you want to do a job properly, you have to have your complete and undivided attention on that job. And if you look at the work quality of individuals with an incessant or with an agitated mind, they are constantly in a rush to get to the future. They start a job, but they will abandon it halfway through because they've started a job, but their attention isn't on what they are doing now. Their attention has rushed to the future. So they don't tend to finish jobs. They don't have their quality of attention on the job. And this marker of concentration should be taught in schools because schools are teaching us how to think. They are teaching us how to break information into tiny pieces, how to question, how to reason, how to analyze. The mind, through education, is developed into an analytical tool. We are trained how to think, but we are not trained how to stop thinking. It's really important that we learn the capacity to bring a stillness to the mind, to bring a quietness to the mind, to bring a gap between thoughts. Because when we have a control over the mind, when we have trained the brain to be focused, we can then hold our attention on whatever we want to hold it upon. Our work is better. Our relationships are better. We are more aware of the thought activity going on in the mind. And especially, we are more aware of the repetitive and the negative and the often self-critical thoughts that go on in the human mind that most people are not aware of, because those thoughts are carrying on in the background. But yet it is these very thoughts that determine our quality of life on earth. We have to bear in mind that the mind is the filter through which we perceive all of life's experiences. And if we have an agitated mind, it will distort our perception. So how do you bring a stillness to the mind? That's by bringing our attention onto the breath. But I don't think you can bring a stillness to the mind unless you have good quality of sleep. And people talk about quality of sleep. They talk about don't watch your mobile phone late at night, avoid blue lights, don't drink alcohol, don't be eating late at night, have your bedroom cool. All of these are fine. But the real elephant in the room is you will never get a quality of sleep unless you breathe through your nose. You should never wake up with a dry mouth in the morning. You should always wake up with a moist mouth in the morning. And if you wake up with a dry mouth in the morning, you are not likely to have a refreshed sleep. And if you don't have if you are not waking up feeling alert from a good and deep quality sleep, then you won't have the focus to partake in your everyday tasks. And like, we have people coming in with anxiety and depression, and I ask them, how do you feel when you wake up in the morning? And they tell me, I wake up exhausted in the morning. And I asked them, has your healthcare professional ever investigated about your sleep? Have they ever asked you, do you snore? Do you stop breathing? Do you have insomnia? Do you get up to go to the bathroom during the middle of the night? No. So sleep. So here we have healthcare professionals treating anxiety, treating depression, treating high stress, but not investigating sleep. How can you deal with anxiety unless you look at sleep and unless you look at breathing?
Since I read your book, I've been taping my mouth. Me and a friend have been both doing it. And I track my sleep on my watch, and my sleep has improved. Like it's dramatically gone up. And I really like this feeling when I wake up of being able to breathe really deeply through my nose. You know, like when I wake up, sometimes when I don't tape my mouth, I feel congested, like maybe I have a mild dust allergy or something, but I feel like I can really breathe properly. Like when I feel fresh, yes. I feel alert. But when I tell people, you know, what I'm doing, or I suggest it to family members, the first question is like, is that safe? You know, what if I cover my nose or something? So how do you get people past that? Is it completely safe? And, you know, how do you deal with those objections?
Yes, yeah. Taping of the mouth, like I've been taping my own mouth since 2002. And, you know, I have no idea how many books I've sold. Like I have a few different books out there. They've sold in fairly good quantities. And we've always included taping of the mouth. Mm-hmm. Now, touch wood, we haven't had issues with it. I don't think that the nose, well, it's not that I don't think, I would never expect the nose to get fully blocked during sleep if you continue breathing through it. Because as long as you breathe through your nose, even if your nose gets partially blocked, as soon as it gets partially blocked, it will change carbon dioxide in the blood because there's a resistance to breathing, and that will open your nose back up again. However, the real issue that we had was taping children. And what I needed to do is I needed to establish children breathing through the nose. And I can send you on the literature, John. When you start looking at this is incredible. we know that between 25 to 50% of studied children persistently mouth breathe. We also know that if a child is persistently mouth breathing, it impacts their sleep quality. And there was a study carried out in Stratford-upon-Avon involving 11,000 children and published by Karen Bonnock. She was one of the authors. It was published about 9 years ago. Children with sleep disorder breathing, and of that, mouth breathing is a major contributory factor. If it's untreated, now this just includes snoring. If it's untreated, these children have a 40% increased risk of special education needs. Because as adults, we wake up and we're feeling pretty lousy, almost as if we have a hangover if you don't have a good night's sleep. But the child's brain is developing, and that's the problem. So, funny, I wasn't anticipating your question, but to overcome the fear and the apprehension about mouth taping, I brought out a tape going back just a few weeks ago. It's called Myo Tape, and this is the tape itself.
Okay.
So I'll just show it to you. It's elasticated. It's kinesio tape, which we had the glue altered, and it's hypoallergenic with cotton, and it's stretchable. Obviously, kinesio tape is, and you put it around the lip. So you see it there. So there's a tension by the tape. There's a tension with the tape, then bring the lips together. So this will encourage children to breathe through their nose during sleep, but there's no risk. If, for instance, the child did have to get sick or something like that, the tape is fine. So the tape solved a major issue that we had. How do you get the mouth closed at night without having risk? And yeah, traditionally we were using 3M micropore tape, especially with adults, and we didn't have any issues with it. But with children, we didn't know what to do. And that's why the Myo tape came out.
That's amazing. That completely solves the problem. It encourages it, but it doesn't force it closed.
Yeah, and the other thing I'd say with children, sometimes working with kids can be a little bit frustrating because, you know, kids are kids and children can have their mouths open, especially when they are distracted. I always encourage parents to have the child wear tape on their lips for about a half an hour a day during the day to try and get the connection between the brain and with breathing, because we want to establish as well, can the child breathe through the nose? Can we open up the nose? And also to change the behavior of breathing. To give you an example, I had a nasal operation back in 1994, and I can't remember exactly the procedure, but I think it was turbinate reduction surgery. That's when the turbinates inside in the nose, part of the turbinates are removed to enable air to flow more freely. But the surgeon never told me to breathe through my nose afterwards. So from 1994 to 1998, I continued mouth breathing. And this is normal with people post-tonsillectomy and adenodectomy in children, and also adults who are after having nasal surgery. That even though the obstruction of the nose is addressed, the behavior isn't addressed. And if you have somebody with hay fever, with rhinitis, or a child with adenoids, enlarged adenoids, this invariably will cause air hunger. And air hunger will cause them to mouth breathe. So now they develop a mouth breathing habit. But that mouth breathing habit also needs to be addressed in addition to changing and addressing the obstruction. But the nose is a remarkable organ. The more you breathe through it, the better it works. And that's something that we have seen with many, many thousands of individuals. And yeah, physical exercise, people will say, well, how on earth can you breathe through your nose when you go for a run? At the start, it's more difficult. But when you run with your mouth closed, it brings you into a zone state. Dr. John Dulyard, he's an Ayurvedic practitioner from the States, and he wrote a book 30 years ago called Mind, Body, Sport, or Body, Mind, and Sport. He had athletes breathe through their noses, and he measured their brain states when they were breathing through their nose during physical exercise. They were entering the zone. So nasal breathing is naturally tapping into that part of the brain that coaches have, you know, it's coveted. How do you get an athlete or an individual to get into a flow state where their attention is moving simultaneously with time, where they are not going to be distracted, and where they can have 100% of the focus doing what they are doing? So in terms of, yeah, and now there's a new paper after coming out, what's out probably a year or two now, George Dallam, He's a professor of exercise sciences from the United States. And what he did was he got 10 recreational athletes. And he said to the recreational athletes, I'm going to test you now, but you have to breathe through your nose during all of your physical exercise for the next 6 months.
Mm.
So these athletes did all of their physical exercise, nasal breathing for 6 months. Then he tested them, breathing through the nose versus breathing through the mouth. Initially, when you switch to physical exercise with the mouth closed, it's tough. And it's tough because carbon dioxide increases. But after a few weeks, that air hunger diminishes because the body adapts to tolerate a higher carbon dioxide buildup.
Mm-hmm.
So when Dalam tested his individuals after they had practiced nasal breathing during all exercise for 6 months, their ventilation was 22% less. They were able to achieve 100% work rate intensity, breathing through the nose versus through the mouth. The respiratory rate with nasal breathing was 39 breaths per minute. With mouth breathing, it was 49 breaths. Carbon dioxide in the blood. With nose breathing, it was 44 millimeters of mercury pressure. With mouth breathing, it was 40. But the fraction of expired oxygen was less with nasal breathing. It doesn't make sense to bring in oxygen into your lungs, for that oxygen to pass into the blood, for that blood to do a round trip, and for you to breathe that oxygen back out again. It makes more sense to bring oxygen into your lungs, into the blood, and for that oxygen to get delivered to the tissues. So the fraction of expired oxygen was reduced with nasal breathing. So nasal breathing in Dalam's studies showed that it improved oxygen delivery or utilization by the body. But we already knew from 1988 that when you breathe through your nose, the pressure of oxygen in the blood increased by 10%. And you think of COVID now, I think it's unfortunate that nobody is talking about nasal breathing from two perspectives. Number one, you do have a gas, nitric oxide, that's released into the nasal cavity. Nitric oxide is antiviral. And there are currently, if you were to Google nitric oxide, COVID, clinical trials, you will see that there are clinical trials in the United States at the moment on nitric oxide as a potential treatment for COVID, but your nose produces this gas. So that's one reason. Now, yes, the inhaled gas, say, in the clinical trials might have a higher concentration, but you can also improve and increase the nitric oxide in the nose by humming and by breath holding. The other reasons that individuals should breathe through their nose is because COVID-19, the water particles that come from breathing are partly responsible for the transmission of it. And if you think it's not just during coughing and sneezing that this water vapor goes into an aerosol, into the atmosphere, and another individual then is inhaling those particles into their body. Talking and breathing also do it. But nose breathing, as you breathe in, your nose moistens the air, incoming air coming into the body. But as you breathe out, your nose traps that moisture, keeps it in the body. So mouth breathers they emit a 42% greater water loss during breathing. So mouth breathers, if you have a person who is infected, and you can imagine if they're with family members, if that individual is a mouth breather, they are going to be emitting a lot more water particles into the atmosphere, increasing the risk of transmission of their family members, because the nose would be the organ of the body that's designed to try and trap and to hold on to that moisture and causing less of it to be released into the atmosphere. Physical exercise with the mouth open doesn't make sense, even from the point of view of dehydration. Use your nose to maintain adequate moisture levels in the body. You shouldn't have a dry mouth with physical exercise, but I'm sure it's very common.
When I watched your video, which I'll provide a link to on COVID, I was kind of just astounded how this information isn't being broadcast, because there are these like nightly sort of news reports on like the data, and there's good advice, wash your hands a lot. But I would imagine, based on the research that you've done, if there was some way of really encouraging everyone on planet Earth now to take up nasal breathing, there would be like a huge impact in the stats. which
Yes.
is
Yes.
crazy. It's like a
Yeah.
crazy thing.
Yeah. It just makes sense. But breathing just, you know, I suppose people think it's too simple. Now, washing hands, you could argue, is very simple. I don't know. I don't have an answer. And I don't like, I also use that video as a point of how can you breathe to improve alveolar ventilation? And if you think of every breath that we take into the body, for example, here's my anatomical model of the nose. So when you take air, you take a breath of air into the body, you're going to leave a part of that air. Part of that air, every breath that you take, part of it remains in the nasal cavity, part of it remains in your throat, in the trachea, in the bronchi, in the bronchioles. So every breath that you take, 150 milliliters of that air doesn't reach the small air sacs in the lungs for ventilation to take place. If you are breathing 12 breaths per minute, just to give you an example, and if the average size of the breath, the normal size, it's a half a liter, 12 by a half a liter is 6 liters. So in the minute, you are taking 6 liters of air into your nose. But how much of that air actually gets into the small air sacs? You have to subtract the amount of air that stays in dead space because it doesn't get to the small air sacs. And the amount of air that stays in dead space is, of course, going to be 12 by 150. So the amount of air that gets into the small air sacs is 4.2 liters. You take 6 liters of air into your nose and 4.2 liters gets into the small air sacs. Now, if you were to bring down your breathing during rest from 12 breaths down to 6 breaths, you are wasting less air in dead space because you've got 6 less breaths per minute and 6 by 150. And that's quite significant. If you look at the maths this way, I have 6 breaths per minute. I'm going to increase the tidal volume proportionately to 1,000 mil. I'm still taking 6 liters of air into my nose, but the amount of air that's got down into the small air sacs has increased from 4.2 to 5.1. There is a 20% improvement in breathing efficiency by slowing down the respiratory rate. Here's the difference with mouth breathing and nose breathing. Mouth breathing is inevitably fast and shallow breathing. It's highly inefficient. And with that, you don't harness nasal nitric oxide. Nitric oxide, not just as an antiviral, but nitric oxide to sterilize the incoming air, and nitric oxide to redistribute the blood throughout the lungs. So in terms of blood oxygen saturation, I could send you on paper. They looked at an individual's climbing Kilimanjaro. These individuals were at a pretty decent height. I can't remember, maybe 5,000 meters, but it's a fairly significant height. And with that, their blood oxygen saturation dropped down to 80%, which is severe hypoxia. They had the individuals slow their breathing down to 6 breaths per minute, and within a few minutes, their blood oxygen saturation increased from 80% to 89%. Now, the problem with COVID is low blood oxygen saturation. And when these individuals are feeling breathless, they are going to breathe fast and shallow, and they are going to breathe entirely the wrong way to breathe to increase their alveolar ventilation, to increase their blood oxygen saturation. So if, for instance, individuals, I don't have a pulse oximeter, actually I do. So here's pulse oximetry here. That one didn't work anyway. So you see I'm just going to check now. So yeah, so there's a little red light on the inside of it, and it's a finger probe that's put on your finger. And it's detecting the saturation of your hemoglobin with oxygen.
Yeah.
And I remember having a client coming in, she had chronic heart failure. And I had her go for a walk, and her blood oxygen saturation went from normal, which is 95 to 99%. It dropped down to 92% during the walk. And it's going into mild hypoxia. It would be a cause of concern. And I looked at her breathing. She was breathing, mouth breathing, fast breathing, shallow breathing. And I said, okay, I would rather if you don't breathe that way, because this is what's happening. You are not harnessing oxygen. You are not, utilizing your breathing efficiently. So I had her put her hands either side of her lower 2 ribs, just where at the base of the ribs, just where it meets the abdomen, just where the diaphragm is. And I said to her, now I would like you to walk. And as you breathe in, I want you to breathe in 2, 3, 4, out 3, 4, 5, 6. So I had her breathe low and slow through her nose, but not over breathing, because we don't want to breathe hard, because that's not going to have a good effect either. So we want to have a balance between the biochemistry, the biomechanics, and the cadence of the breath. Her blood oxygen saturation increased from 92% to 96% within about a minute of doing that exercise. And these are simple things, that should be out there, that individuals who are susceptible to COVID and who have the infection, that they are going to, it's possible that it is going to drop their blood oxygen saturation, that they could be practicing breathing techniques at home to improve their SpO2, and could be very simply done. I think that's why that video went viral. To be honest with you, that video wasn't recorded for YouTube. I put out a simple webinar for our own members, and it oversubscribed and people were disappointed. So I did record it, and then I said, okay, we'll put it out on YouTube, but we didn't expect it to have the volume of traffic. The quality is terrible. I was a little bit all over the place, but at the same time, I got across a few points there that was pretty important for people.
What I really liked, I've sent the video to family members, and I thought the video was great. But what I really liked about it was a lot of the things that you are recommending are not like these crazy things that we should do only if we have a virus. I mean, it's sort of like good practices in general for your health. Yeah. So in a way, if you start practicing and getting used to these techniques now, it's going to help prevent it. It's going to help you if you do get it. It's got so many benefits, and it's going to help you in general.
Yeah. I think, like, if you look at the population, how much does breathing get attention? I will tell you how little it gets attention. I can only find one study looking at in the investigation of the amount of adults who are breathing through an open mouth. That's it. One study, a Japanese study, which was completed by questionnaire. So medical researchers have completed very few studies on mouth breathing and nose breathing in the adult human. There are a number of studies, and quite a number of them, for sleep. And this was driven by the work of a French doctor called Dr. Christian Guilleminault, who coined the phrase obstructive sleep apnea. So he would be considered as one of the founding fathers of sleep medicine. And I remember going to medical conferences. I was talking at them in different places, and we would cross paths because he was talking about sleep and I was talking about breathing during sleep. But at one of those conferences, I remember him standing up, and he said to the doctors there, and you can have a large group of people, you could have 500 to 1,000 doctors at one of these rooms of gatherings. He said, doctors, you are talking about many, many things, but you are missing the one thing here. And the one thing during sleep is to breathe through the nose. And Dr. Christian Guilleminault, the pioneer you could regard of sleep medicine, talking about, and I will quote him here, the critical importance of restoring nasal breathing, both during wakefulness and sleep. And he goes on again, the complete and only valid correction of pediatric obstructive sleep apnea or pediatric sleep disorder breathing is continuous restoration of nasal breathing. And it hasn't trickled down. So, the research in sleep is starting to catch up because obstructive sleep apnea has changed in the last 5 years with different recognitions of phenotypes. But for anxiety, how many people who, when they get stressed, are breathing through an open mouth, and all that's going to do is feed back into the anxiety. We are not breathing dysfunctionally because of the condition. The dysfunctional breathing is feeding back into the condition. We have to consider that feedback loop. Of course, anxiety will change breathing patterns, but it's the change to breathing that's feeding back into it. The same with asthma.
Yeah, that's been a big thing that I'm getting from this conversation, is the cause and effect between those two things.
Yes.
To rethink that. I wanted to ask you about general breath holding, like free divers and you have apnea training apps and things.
Yes.
I've seen that there are generally two methods. One is to increase carbon dioxide tolerance, I think, and then the other one is to increase ability to handle low oxygen levels.
Yes.
Are those two both things that improve as part of the Oxygen Advantage program? Is any one of those, specific to free diving that we don't need to worry about, or how do you see apnea training and free diving training?
I suppose there's a number of ways of doing apnea training. If you look at the Wim Hof technique, it's 30 large breaths taken into the body. That gets rid of a lot of carbon dioxide. Carbon dioxide is the drive to breathe. So if you deplete your carbon dioxide, you don't feel the sensation to breathe. And as a result, you can hold your breath for a lot longer. And as you hold your breath for a lot longer, your blood oxygen saturation can go lower. So the Wim Hof technique, because of the hyperventilation, it would be a hypoxic effect, but it's also a hypocapnic effect. Wim Hof technique would be more severe in terms of the drop to blood oxygen saturation of what we achieve. I typically want blood oxygen saturation to drop down to about 85%. It's a sufficient training stimulus. You are going into severe hypoxia, but I don't have the risk of people passing out on me. So when you go into the 70s, you get disoriented. But if you go down into the 60s, into the 50s, you can pass out because of the hypoxia. I don't want that. So one aspect of it, when we do the exhale hold, we are increasing carbon dioxide quite significantly. And we don't do breath holding following a hyperventilation. We do breath holding following normal breathing. You take a normal breath in through your nose, a normal breath out, you hold your nose. You start walking holding your breath. Then you start walking faster, then jog, then run. And keep running with breath holding. You will feel the involuntary contractions of the breathing muscles. And when you resume breathing, take 6 minimal breaths. And the reason being is because I want to prolong the hypoxic hypercapnic response, because I want to drop the blood oxygen saturation. So when we're doing oxygen advantage, our objective is to drop the blood oxygen saturation down to severe hypoxia and to increase carbon dioxide to quite high levels, typically above 50, 55 millimeters of mercury pressure. It will be akin to free divers, that if they are not doing hyperventilation, and also maybe the free divers, they will be doing some exercise that they breathe in and hold. If you breathe in and hold, you are less likely to drop your blood oxygen saturation. And the reason being is because if you take a breath of air into your lungs, you've taken a good quantity of oxygen into your lungs, which is going to diffuse into the blood. So it's going to take a lot longer of a breath hold to drop your blood oxygen saturation. So yeah, there's going to be some similarities. There's similarities and there's small differences. But I think, anytime you do a strong breath hold, if you do it following normal breathing, it will generally be a hypercapnic response. So whether you breathe in and hold your breath, you're going to increase carbon dioxide. Or if you breathe in, breathe out and hold your breath, you still increase carbon dioxide. If you breathe in and hold your breath, you can get a hypoxic effect, of course, but it takes a lot longer during the breath hold to get that hypoxic effect. It's a lot easier to drop your blood oxygen saturation when you take a normal breath in and out and hold. And the reason that I do it with physical exercise is because throughout our evolution, the human body has always identified air hunger with physical exercise. So when we start off with the breath hold, the person is going easy. And then as the air hunger increases, we intensify the pace. We intensify the movement so that we are matching movement with air hunger. And at the end, I put in the 6 minimal breaths at the very, very end. And it can be quite challenging. It's just because there is a delay. It takes about 16 seconds from the blood in the lungs to show in the fingertips. So when you resume breathing, I want to continue the individual with that effect to show that the blood oxygen saturation is dropping. So yeah, breath holding is very interesting. It's a great way in terms of forcing the body to make adaptations. And those adaptations would include improving the buffering capacity, delaying lactic acid and fatigue, increasing blood flow to the brain. If you hold your breath without hyperventilating beforehand, but if you hold your breath, it will increase blood flow to the brain. It will also increase oxygen delivery, depending on the extent to which you go hypoxic. And you can also open up your nose. If you have hay fever, do that exercise. If you have asthma, do that exercise. But don't do strong breath holding if you've got severe medical conditions. Don't do strong breath holding if you have panic disorder. And the reason being is I have made mistakes too, with individuals coming in, because I've seen so many individuals over the years, even doing reduced breathing with some groups with panic disorder. We can feel uncomfortable when we have air hunger. It's designed to make you feel uncomfortable. But a person with a strong feeling towards the suffocation, they think they are going to die. It's an entirely different, that it's really, they have a strong reaction. And I'll give you an example. I had a youngster, 20 years of age. He had a stuffy nose. He had asthma. He didn't write down on the form that he had panic disorder. So I didn't know he had panic disorder. I had him do the strong breath toast, to open up the nose and help his lungs. And it put him into such a state of fight or flight that 5 o'clock that evening, he admitted himself to accident and emergency. Now, he was fine, but he didn't think he was fine. So psychologically, we have to be careful with breathing exercises. They should be tailored to the individual. We really need to look at individuals coming in. What is their BOLT score? What is their state of health? What ages are they? Do they do physical exercise? How can they incorporate it into their way of life? And what do they want to get out of these exercises? And with that, we can tailor exercise because, the breakdown of the different exercises we have with Oxygen Advantage now, we have 14 different exercises, but some of them have a number of different variations. So probably we have about close on 20 different exercises. So, it's relatively extensive now to what it was when I first wrote the book, and we're increasing it all the time. And that gives us a toolbox that we can work with people, So, but I would say to anybody, there are exercises that everybody can practice. Nose breathing, for example. Many small breath holds if the mind is stressed. A person with a very agitated mind in a state of emotional turmoil, it is very difficult for them to practice slowing down their breathing. It's very difficult for them to put their attention on their breath. If your mind is agitated, or if you're in a state of high stress, hold your breath. But don't hold your breath for too long, because that will put you into a fight or flight. So the exercise that we would use for calming the mind, take a small breath in, a normal breath in and out through your nose, hold your nose, and count 5, 4, 3, 2, 1. Let go, breathe in through your nose, and then breathe normal for about a half a minute or so. And again, you take a normal breath in, normal breath out, hold your nose, 5, 4, 3, 2, 1. Let go, but to breathe in. So we use that exercise as an emergency exercise for people with respiratory distress or people with anxiety.
Yeah, that's very useful. Checking in where you're at and being honest with yourself. Do you have anxiety? And then sort of not dive. I mean, it's kind of foolish to dive straight into really strong breath holds if you
Yes.
are sensitive to suffocation sensations. Where can we get the latest stuff from you? If we've read the Oxygen Advantage and we want to go deeper into your work, where's the best place to find?
I think it's something that's accessible to people. I do a 2-hour masterclass, and I do it live online. Now, we've always done them, but they've just, they've kind of become more popular now. And with that, I go through all of the exercises by Zoom. So we typically have a group of about 20 people in the masterclass. Sometimes it can be a little bit more, just given the times that it is. And I go through every single exercise. And then they get the recording of those exercises then the following day. So they can have that indefinitely. They download to their computer. So that would bring people up to speed with all of the exercise, but also for me to work with them firsthand. So what I do is I zoom my camera, or I just click my camera in on the individuals, and I go from person to person. And where I can give feedback. And that helps everybody. So that could be a useful way. Like, it's $95 for 2 hours, which is not overly expensive. And, they get the recording afterwards. We put up different articles about nose breathing, stimulating the vagus nerve, the relationship between breathing pattern disorders. And if you just go to oxygenadvantage.com and click on About, Science, then you will see all the different, when you click on the links, you'll see all the different articles. So people who, they want to see the background and the science, they can check it out. In terms of sleep, asthma, and anxiety, our website is buteycoclinic.com. And I've put some articles there. And I also do masterclasses for people with sleep issues, anxiety, and asthma. And it's the same format. It's $95. And the reason that it's priced in dollars is because a lot of my work is in the United States. So it's not priced in euro or sterling, but in dollars. And 2 hours, and you get the recording afterwards. But it can be very useful, because I think a book can bring you so far. And as a person who is writing the book, how much detail do you want to put into a book without drowning the reader with information? And
Right.
the oxygen advantage, you can put in so much. And then you also have to consider is when a person is reading the book, even when you think that you are explaining it clearly, how is that person interpreting the information from the book? And that's the one thing about videos. It's visual, it's auditory, and we can get some interaction, and I can answer questions then. So yeah, so I think it's a nice format.
Yeah, I really like that. And I mean, that's actually really incredible value because you get to, it's a live workshop, a
Yeah.
masterclass. You could easily like avoid doing that. You could think it's too much work, but I can tell that you really like working with people and helping people, which is, I get that from watching you and listening to your work, which is really great.
Cool. Yeah. I'm lucky. I'm one of the few people who found a job that was suited to them. So sometimes life will steer us in different directions and there can be a silver lining. But I really found a job. I love reading the research. I love putting the exercises together and I love putting them out there for people. And yeah, I think it's great. I've been very fortunate. So it's good.
And one of the, I think, traps in the sort of health space or the self-improvement space is that we stumble upon a book or something and we get excited about it, then we kind of like forget it. And
Yes.
I really cautioned myself and other people with the oxygen advantage, because breathing is something that, the road to mastery is very long and amazing. It's a journey. You don't just tape your mouth for 3 weeks and then think you've got it all sorted,
Yes.
right?
Yes. Yeah.
So it's something that we can always continue to learn, and what might be a sticking point for someone at the beginning, they might start doing jogging and then get into a different aspect of it
Yes.
later on.
Yeah. John, I think people should kind of investigate the potential when we apply breathing exercises correctly. And there is misinformation out there, and I can understand that people get confused, and even if we go to say, if you went to some yoga courses, you will hear the instructor saying, take full and big and deep breaths. And the yoga instructor is emphasizing the biomechanics of breathing, but in the process could be sacrificing the biochemistry of breath. And the breath, as you were talking about, it's not just that simple. It's simple, but it's not so simple. And we need to have a balance between the biochemistry, the biomechanics, and the cadence of the breath. But the best way for people to understand it is during rest, even if you were just to practice this, you could put your hands either side of your lower two ribs. And as you breathe in ever so slowly for a count of 4 seconds. And ever so slowly out. So breathe in for 4 seconds in and 6 seconds gently out, but breathe so light during that process that you almost feel you are hardly taking any air into your nose. So as you breathe light, you're addressing and helping to improve the biochemistry. As you breathe deep, it's helping to calm the mind. And as you breathe down to 6 breaths per minute, it's helping to stimulate the vagus nerve to increase vagus nerve traffic. And without making it too complicated, people to try that, if you slow down and reduce your breathing volume for a period of a few minutes, can you increase the warmth in your fingers? Can you feel sensations happening in the body? And it's really the best way to realize the power of the breath, in that you can influence, even if it was just to improve your blood circulation, that you can bring warmth into your hands by breathing less air than what you normally breathe. And that alone can be enough to tell people that, yes, there's something in this.
Yeah, that's and that's something that we can all do today upon listening to this.
Absolutely.
So yeah, we've covered a lot of the things that I wanted to go over. That was really useful for me personally as well, just to hear those things clarified. And I have no doubt it will be very useful to the listeners as well. So thank you so much for your time. I really appreciate it.
You're very welcome.